Hello everyone, and welcome to this audio podcast. This audio podcast, as part of Labostix International, this audio podcast is part of a Sonar and Critical. This audio podcast is part of an Interstellar and Rampage. This audio podcast as part of a Storm Labostix production. Through this audio podcast today, I look at some of the literature. I look at some of the literature in around what it means to what it means to cope with chronic kidney disease and chronic kidney disease with other conditions. So, although some research has provided or offered sort of valuable insights into the ways patients cope with chronic illnesses or chronic illnesses and the effects of coping on chronic illness and adjustment, it is difficult. It is difficult or challenges to determine the precise value of such information such information or understanding for different chronic conditions. It is important to gain or attain better insight into the type of stresses, for example, experienced by recipients suffering different chronic conditions, as information as information on the nature of disease related stresses may contribute to a better understanding of recipients a better understanding of recipients and recipients or patient recipients or patients and in amongst along two coping strategies. Literature has also sort of investigated some of the concepts, and literature has a literature review had from in around 2012 to 2012 had surmised as how young people cope with chronic kidney disease. The literature review by Mohammed and team from 2012 looked to uncover three main themes surrounding coping. Firstly, lack of a coping definition. Secondly, coping strategies in young people, and thirdly, barriers to the understanding of coping in young people. There is also evidence. There is also evidence to suggest the rates of acute rejection are in context of transplantation are higher when when young people have more than one healthcare condition. By implementing healthcare educational clinics, for example, this can and could improve young people's lives. Additionally, through educational clinics, for example, for children and young people accessing children and young people access to knowledge with access to knowledge in aspects of access to knowledge should involve or include sort of in around sort of not where young people with chronic kidney disease and other conditions look to access knowledge in around aspects pertaining to for example lab tests and investigations, surgery, aspects of nutrition, kidney replacement therapy or KRT or RRT, aspects in around aspects in around wellness and related aspects in around pharmacotherapeutics, or in around aspects pertaining to pharmacy, aspects in around lifestyle aspects in around physical aspects in around physical activity, aspects in around peer support, and in around infections. And there has been works that have published some sort of initial data, some initial data in around sort of themes, in around sort of educational themes, works by Mohammed and team from 2024. This can support children and young people in CKD and other conditions and families with the most important elements of healthcare. The last decade has seen research gather some momentum with the development of an objective evidence-based investigating sort of the use of social media and integrating healthcare services for CKD recipients and other healthcare conditions. And There have been some retrospective works published by Mohammed and team in around 2014. So that draws this audio podcast to a close. Again, the literature in around the projected works goes into a bit more a sort of bit more detail. However, that is the detail is accessible. Also, more detail in around the literature is accessible or is conveyed in some more detail with and under the organization, the Renal Patient Support Group, the RPSG. So that draws this audio podcast to a close. This audio podcast as part of Labostix International. This audio podcast is part of a Sonar and Critical. This audio podcast is part of an Interstellar and Rampage. This audio podcast as part of a Storm Labostix production.